Director of Hubei Province Health Committee. So first, we'd like to give the floor to Mr. Liang to update us about the newest information of the COVID-19 in the Hubei Province. By the 12th of March, the total reported cases in Hubei is reaching 64,827 cases, among which Wuhan is accounting for 74%. For other areas outside of Wuhan, it is actually accounting for 27% across the province. Until the 11th of March 2020, the newly added cases in Hubei province is accounted at 8 cases. Since the province has echoed provincial level emergency mechanisms, this is the first time that the newly added cases reaching a one-digit level. All the newly increased cases is from the city of Wuhan. Other different cities, localities report no newly added cases. There's no imported cases from other different countries. And for the consecutive 7 days, there's no newly added cases in other cities among Wuhan, among which Shenongjia, Xianlin, Xiangyang, Xiantao, Tianmen, and Suizhou has reported no new case 14 days in a row. By the 11th March 2020, there are 12,769 patients enrolled in the hospital, among which 700 is in severe condition. The total death roll is reaching 3,070 cases. Yesterday, the newly added death toll is reaching 50%, among which 70% is being accounted in Wuhan City. To the 11th of March 2020, the discharged number is reaching 2,800 cases. The newly added in discharged ratio is 1,122, and Wuhan City is accounted for 85% of the discharged number. Starting from the 9th of February, the newly discharged cases has surpassing the newly confirmed cases for the consecutive 22 days. That is my briefing. So here we'd like to give the floor to Mr. Hu Shuguang. By the 10th of March, at a critical moment for the battle against the COVID-19, General Secretary Xi Jinping paid a visit to Wuhan to make a survey about the prevention control work of the COVID-19 in Wuhan. He also analyzing the outbreak of the COVID-19 in Wuhan City, and he gave us full support during his visit. He also gave us new missions and requirements during his visit. This is pointing out new directions for the all-out win in the battle against COVID-19. On behalf of the people across the nation, the General Secretary Xi Jinping is expressing his deep support to the citizens in Wuhan. This has further strengthened the confidence of Wuhan people in our battle against the COVID-19. General Secretary Xi Jinping pointed out that there are 2 battlefields to fight against COVID-19. One battlefield is in the hospital, where the prevention and control is conducted. Another battlefield is the community, where most of the prevention and control happens. So, General Secretary Xi Jinping also wants us to increase the discharge ratio as large as possible and lower down the mobility ratio as much as possible. And we also want to enlarge the outcomes of the curement ratios. Let me give you the updates on the 2 fronts. Firstly, the medical treatment of the COVID-19. Until today, the newly added cases in Wuhan has claimed a single-digit number. That is an indication of a very good trajectories in the city of Wuhan. But among the newly confirmed cases, there are still 4,000 people who are in critical conditions. That is also means a daunting task for all of us. During his visit to Wuhan City, President Xi Jinping pointed out that the medical rescue work is our priority, and we should work on the precision treatment. And we should cure more people and lower down the mobility ratio as much as possible. We should also concentrate the best resources for the severe patients. We should transfer and refer them to high-level hospitals. We have dignified Tongji Hospital and the People's Hospital of the province to become the center to gather the severe patients. There are over 40,000 patients being referred to these high-level hospitals and get a high-quality treatment. Secondly, we are launching a battle towards all the patients. After we enrolled all the severe cases into the designated hospital, we started another journey to make sure that every single patient who are infected with the COVID-19 is getting the treatment in a timely manner. Thirdly, we receive and enroll every patient that we could in the city of Wuhan. We have a saying that is go where there is an epidemic, fight until it perishes. We have the community level workers helping us to identify all the confirmed cases and suspected cases. This actually helps us to avoid any transition from the patients. Early detection, early report, early quarantine, and early treatment. Fourthly, we have also do a very good scrutinizing work. We check every single patient that we could. Our current capacities of the nuclear acid test is reaching 20,000 units per day, and the testing speed is increased to 4 to 5 hours. And the report and feedback is also being conducted in a timely manner. This has gaining us valuable time in the battle against COVID-19. Fifth, we have also gathered a strong team of medical experts. And all of these experts is provided tailor-made medical solutions for all the severe patients. By targeted medical treatment and medical measures, we increase the treatment speed and improve the treatment quality. Sixthly, by combining the TCM with the Western medicine, there are 36 national-level experts and provincial-level experts who are forming 12 different suspicion teams in all the hospitals across the city. We are adopting measures combining the TCM and the Western medicine. After several different tours to the designated hospitals, and after checking with 60,000 patients, we have securely stabilized the mortality and the mobility ratio. Currently, in the city of Wuhan, 2/3 of the patients is being cured. That is a quite remarkable achievement. Secondly, the construction and building up of the virus-free community. At an early stage, the city of Wuhan is adopting very strict measures in the different communities. It is actually helping us to cut down the transition And the fact has proven that it is very effective. So this good momentum today is all due to the effort we paid before. Starting from the 3rd of March, we started the construction and build-up of this virus-free community. This is another measure we have taken up after the lockdown of the community, and it is actually laying an important foundation for us to win the battle against the COVID-19. The actual practice for us means that we should have a very strict standards. For the virus-free community, we have defined that there is no single outbreak in this community. We have used 40 consecutive days as a time period to measure the outbreak of the COVID-19. Meanwhile, for all the suspected cases, close contact, asymptomatic fever patient, they have to wait for their diagnosis result in the hospital. If the diagnosis result comes out and there is no confirmed cases, the community is going to be identified as a virus-free community. At the same time, to fully promote it and spread the prevention and control at the community level, we have the second condition, which has 6 requirements. There is a good promotion in the community level. There's a very good risk control measures, good survey measures, good sterilization measures, and good day-to-day logistic supplies. With 6 guarantee measures, it actually covers every aspect of the community life. It generated a comprehensive picture for us to control and prevent the outbreak in the community level. Virus-free community is a fruition of all the efforts. Secondly, we standardized our procedures for the virus-free community. The approval procedure is being decided by several different governmental layers. So one community is included several different residential areas. During the risk control procedure, we have a very gradually stricter procedure. There are several different gates in one residential area. We left only 1 gate. For some of the residential area with no logistic or day-to-day management company, it is very difficult for us to manage all the residents' activity. We actually draw different areas together to prevent and control the spread of the disease. The actual physical prevention and control is being practiced in around 1,700 different communities. We take one residential area as a unit. If there is no outbreak of the coronavirus in 40 days consecutively, they will report to the community level, and they will have the first approval from the community level, and then the community level is going to report to the city level. And the evaluation work is coming from the city level. Thirdly, starting from the community level, and with virus-free residential area, the community can also apply for the virus-free community title. If all the residential areas in one street is cleared virus-free, they can claim for the virus-free street. If all the streets in one single district is becoming virus-free, they are going to report it to the city as a virus-free district. The work started from the residential area to the community to the streets. In the rural areas of the Wuhan city, we started our work at the village level. And the promotions of this campaign, we have strengthened coordination, and we initiated all the citizens to participate in the campaign. This helps us to promote the result of the risk control, and this has also enabled all the citizens in Wuhan to understand the policies and efforts to fight against the COVID-19 from our governments. And they also have a very good understandings about healthcare measures to fight against COVID-19. We have claimed a periodical victories in the virus-free area to 11th of the March. There are 7,120 different residential areas and 1,500 different villages have claimed 3,500 virus-free residential area, accounting for 55% of the city. Virus-free community is totaling at 250, accounting for 60%. There are 1,900 different villages across the city who claims no virus. Today we have received 11 different streets and townships claims no virus cases. Through the building up of the virus-free areas and controlling measures of the virus-free area, we can generate the conclusions that there is a periodical victory to fight against the COVID-19. Going forward, while implementing the measures of the virus-free and also the prevention and control, we are also going to prioritize our effort towards COVID-19. We are not going to relax and loose. And we are also going to continue our effort to battle against the epidemic and protect the heroic city of Wuhan. Now the floor is open for questions. Please identify your media affiliation before the questions. With People's Daily, by March the 11th, there are 8 confirmed cases in Wuhan city. That is to say, for the most residential area of the Wuhan, it is actually being identified as a virus-free residential area. What is the meaning to this campaign against COVID-19? Thank you very much for your question. As I have reported to you, the general momentum of the battle against COVID-19 is being shifted into a very good trajectory, but we should not relax and lose. The task is still daunting, and the task is also very important facing in front of us, and it is also very meaningful for us to create virus-free residential area. I think it has several meanings. This means that we have a level-based, area-based controlling measures in the city of Wuhan. There are 7,100 different residential areas and 1,400 different communities in the cities of Wuhan. During the outbreak of the COVID-19, different areas have different scenarios. Some of the areas suffered greatly of the COVID-19. But for the city of Wuhan, we are under one mechanism. After the 23rd of January, the city of Wuhan is being locked down. How do we prevent the control internally, and how do we stop the spread of the disease to the external provinces? It is very important for us to conduct the virus-free risk measures. We actually started the measures at the 11th of February. We all know the city is being locked down at the 23rd of January. Before that, we don't have a full awareness about this problem. So since we conducted the measures starting from the 11th of February, the result is very distinct. If you look at the different confirmed cases, you will understand that the confirmed cases is being dropped from 4-digit numbers to 3-digit numbers within 10 days. And the number dropped down further to 3 digits and to 2 digits. Until yesterday, for the first time, Wuhan City claimed 8 confirmed cases. That is to say, the risk control measures is a correct path for us to choose. But we should not sit down and relax for what we have achieved so far. With so many confirmed cases in the city of Wuhan, it is being brought by the first patient who got the disease. So we can imagine that as long as there's one single infection, as long as there's one patient, the risk and control work is worthy to do. Secondly, the prevention and control of the virus-free zone is fully in line with General Secretary Xi Jinping's requirements. We should let everybody to be a part of the campaign, and this means that every citizen is going to help us. Everybody is a part of the battle to fight against the COVID-19. As long as we united everybody, we can win the battle against COVID-19 in a city which claims over 10,000 residents, 10,000 million residents. By combining small victories, the battle is going to win. And this is the most critical battle for us to protect the city of Wuhan. As long as every step is conquered, the virus-free community can be achieved. Virus-free residential area can be achieved. Finally, the whole city of Wuhan can be virus-free. We should strengthen confidence until we achieve the final result. With CCTV, according to the national diagnosis measures for the severe cases, we can use the blood plasma of the infected patients to treat them. So what is the result of the blood plasma? How does the infected patients should not to donate their blood? And the general guidelines for the medical treatment of the COVID-19 issued by the NCP. The plasma is a very important measure for us to treat the patients. After infected with the COVID-19, the patient is going to generate the antibodies naturally. So for the plasmas, with the antibody, it is a very effective measure for us to treat more patients. The blood plasmas during the recovery period is being used at the severe patients. In principle, the blood plasma is not going to last it for 3 weeks. After a comprehensive evaluation, Each piece of the blood plasma is going to be used on top of the patients. Not all the patients are suited to use the blood plasma treatment method, and the treatment method is still under observation. From the result, the clinical symptom is improved dramatically. Experts at the hospital, with their evaluation and approval of the patient's family members, they can apply for the delivery of the plasma from the Wuhan City level health commission. For the patients who have been cured after 40 days, and if there is no risk exposures who are aged between 18 to 55 after the evaluations of the doctor, they can donate their blood plasma. Currently, we have several different donation centers in the People's Hospital and the Fan Yuehui blood collecting vehicle, Wuhan Jinyintan Hospital, among other different 6 donation collecting centers. For the further information, you can go to our official website to apply for the donations of the plasma. Here, we are calling that all the recovered patients join us in the campaign to help more life and more patients. Thank you. With Legal Daily. During the construction and building up of the virus-free residential area, what kind of city-level measures did you adopt it? Thank you very much for your question. This is also a question that is being deeply concerned by the citizens in Wuhan. During the promotions of the virus-free zones, one important task and one important target is to give more confidence to the citizens. That is the reason why we have adopted a series of the intensive inventive measures. For those who are confirmed as a virus-free residential area, the residents can adopt it and can exercise in their residential area. For the village who claimed virus-free, the villagers can also exercise in their village. And for those who are living in the virus-free communities, it is going to be a very important part of their quarantine time. Thirdly, we have publicized all the community, virus-free communities' name in the media and in the news. This is going to give the citizens in this residential area more honors. For example, in the 6th of March, 9th of March, and today, we have published these community names and village names in the Yangtze River Daily. Fourthly, we have, after publishing all of the names, all of these virus-free communities is a part of our day-to-day updates. And it is also going to be an important part for our community cultural level build-up with China Daily. TCM is playing an important role in the battle against COVID-19. Can you give us more information about TCM and its function after the outbreak of the COVID-19? According to the general guidelines of our principal work, we are adopting a combination effort between the TCM and Western medicine, and we have fully played the role of traditional Chinese medicine, especially in the designated hospital, makeshift hospital. TCM is playing an ever more increasing role. First, we have built up a prevention and control mechanism for the TCM. We have also formed a special team of the TCM experts and conducted a conference treatment of the TCM experts. Secondly, we actively promoted the role of TCM in the prevention and control efforts. While we are taking the patients in, the makeshift hospital, we have adopted a TCM treatment measures. Every single makeshift hospital is being arranged 2 to 3 TCM experts to conduct several different treatments. So far, the TCM has helped us to treat 8,300 patients. And in different quarantining areas, we are promoting the usage of TCMs and other different medicines. In all of these quarantining areas, we promoted the spread of TCM, and TCM is also providing a lot of guidance in their day-to-day intake. The combination between the TCM and Western medicine, compared with independent usage of TCM and also independent usage of Western medicine, can improve the patient's symptom greatly and shorten the period for recovery, and it is also increase the testing result of the nuclear acid testing greatly, and it is also very helpful in us to increase the cure ratio and lower down the mobility ratio. According to the data you have mentioned so far, virus-free community is gradually grow into skills. So what is your measures for the next steps building up of the virus-free area? Thank you very much for your question. Just as I have introduced before, virus-free residential area, virus-free community has achieved a very good result. That is to say, we have claimed periodical results. We are going to sum up our experience, and we are also going to follow up our work in the coming different forefronts. Firstly, we are going to spread the result to the community level and residential level. This is not a simple number. In this battle, there are over 700 quarantine areas, which used to be hotels, restaurants, and schools. They are scatteredly distributed in the different communities. For the existence of the quarantine area, it is affecting the result of the virus-free residential area and virus-free community. That is to say, with a shrinking population in the quarantine area, the number of the virus-free community is added up. Secondly, we also want to give the virus-free community a very deep content. Going forward, we are going to provide a very good day-to-day logistic supplies to this virus-free community and virus-free residential area. And we are also going to consider how do we provide the health certification for those of the citizens and residents who are living in this virus-free area. How do we give them a certification for those of the residents and for the recovery and occurrence of the working conditions. How do we provide it sufficient qualification? And we have also adjusted the scientific prevention and control in the community level. To be frankly, this is a daunting task. It has been lasted for 50 days after the long lockdown of Wuhan. Every single one citizens stay at home. Going forward, if we enable all the residents in the virus-free area to exercise in their community, if we are going to give them wider area for exercise, this is going to greatly increase their enthusiasm in participating of the battle against COVID-19. Thirdly, this is not only a work of sterilization, logistics supply, it is also about the mental health of the general public, and it is also about the poverty relief work of the residents in this area. And we are also going to create a very good culture in this different virus-free community. Finally, through the media's promotion, we are also going to show other people good practices, and this is going to help us generate a very good momentum, and this is going to encourage the people in the city of Wuhan. Finally, using this opportunity, I want to show my personal appreciation and thanks from our prevention and control team. We want to thank all the residents in the city of Wuhan for your stay at home for the past 50 days. It is a very difficult journey. Many of the families and several different family members are being struggled in one apartment. And the day-to-day supplements sometimes is below the normal level. But for the citizens and for the peoples in Wuhan, we have survived and won the battle. As General Secretary Xi Jinping pointed out, Wuhan is a heroic city and the citizens are heroes. We are going to win the battle, the final battle against COVID-19. Your names is going to be leave on the historic record. I hope all the citizens of Wuhan is going to stick to the practice until our final day in this battle. Thank you. With Hubei broadcast, many different hospitals are becoming designated hospital in the battle against COVID-19. And we believe that the prevention and control towards the COVID-19 is generating a very good momentum. So how do we arrange the functions in the different hospitals? Thank you very much for your question. The prevention and control of COVID-19 is turning into a very good momentum, but we have a very increasing demand of the patients for other different diseases. Under the general guidelines of the controlling teams from the CPC Central Committee, we are going to shift the different functions of the hospital back to its normal hospital. All the COVID-19 patients is going to be gathered at top 10 hospital in Wuhan, and we are going to gradually resume the ability and capacity for the other hospitals to treat the patients. We planned our recovery work in 4 branches, and for the first branch, it is happened at 11 different hospitals. The second branch of the hospital is going to cover 80 different hospitals. It is going to be finished at the 5th of the March. It is covered the People's Hospital of the New City and the city-level hospital. For the third branch, we are also going to gradually recover the normal functions of other different hospitals, and we plan to finish the work at the 20th of the March. The final branch of the hospital is going to be finished at the 31st of the March. That is the Tongji Hospital. According to our general plan, all the hospital is going to prepare themselves in the emergency treatment measures and other different normal functions. According to the guideline, all the hospitals is going to resume their functions, and they are also going to resume their effort in the prevention and control. And after that, we are still going to conduct a very strict measures to prevent the medical workers and to protect the medical workers. We are also going to gradually guide the inflow of the patients. We suggested all the patients to take a gradual measures, and we encourage remote medical treatment online. And we also encourage a concentrated logistic supply of the medicines. The 10 hospital includes Tongji Hospital, Xiehe Hospital, Huoshenshan Hospital, and Jinyintan Hospital, among other different 10 hospitals. We hope that all the medical workers is going to be transferred to all of these top 10 hospitals. The patients is going to be gathered in these 10 hospitals. Final question. With Jinchu Daily, during the outbreak of the COVID-19, the daily necessities of the residents is being procured and supplied through the residential area level or community level. So after we conducted the measures of the virus-free community, how will we suggest the citizens to protect themselves? Thank you very much for your question. For the distribution and gathering of the daily necessities at the community level, we are going to organize a timely manner. We should select the best location for the distribution of the daily necessities. For the outdoors, we are going to select a very good outdoor area, and we also suggested the community to adopt it and collect their daily necessities in different time period across the whole day. What's more important? We need to avoid the citizens living in one building to come out at the same time, especially for the high-rising buildings. This might trigger a concentration of the people in the elevators and other different areas. Thirdly, we are also going to distribute the daily necessity in a timely manner. We don't advocate for the large area sterilization, but every day after the distributions of the daily necessity, we suggested alcohol sterilization measures to be spread in the areas of the distribution point. And for the residents, we suggest you to follow our measures and requirements and to protect yourself. Stay at home as patiently as you can. Follow the time requirement strictly, and when you are outdoors, please wear the facial mask. Under normal circumstances, you don't need to wear the protective gloves. And if you go back to your home, please wash your hand professionally. And the distance between different residents when gathering the daily necessity distribution is going to be above 1 meter. And the distribution process should be far beyond the gathered area for the whole population. And after you went back home, you can use a 75% of the alcohol to sterilize yourself. And you can put your coat in the balcony for the ventilation. If you have buy the vegetables or procure the vegetables, we suggest you to use the lukewarm water to wash the vegetable clearly for a longer period of time. Finally, we suggested that you should buy whatever daily necessities you needed, especially for some of the fresh fruit and vegetable. Hauling is a bad habit. Thank you very much for all the questions. With that, we conclude today's press briefing. Thank you.